So the autopsies, the histology, the macro and microscopic findings would have been invaluable in helping treat patients that were critically ill. So I think we had a scarcity of that at the start of the pandemic for whatever reasons there were.
I think that the reason I asked you that question, Shankara, is that genuinely I thought that this was being done, and actually being done at an accelerated rate in the context of the pandemic, because you would have had these patients dying of COVID-19. My assumption was that literally almost every COVID-19 patient who died would have had full detailed autopsies. Rory, was that a false assumption by us as clinicians and even the public?
Yes, definitely so. I'm afraid that was a false assumption. I think the dangers of the virus were exaggerated early on. The autopsies are discouraged in certain diseases like Ebola virus, for instance, where there could be a risk to the pathologist and the mortuary staff. So in a case of, like, say, Ebola virus, maybe you just take a liver biopsy or some very limited examination of the organs. But this was not the case with COVID. I think maybe the risks were exaggerated. I'm not sure why doctors were not more interested, especially pathologists, to learn more. And why, I'm not sure the reasons, but unfortunately, postmortems were not done in the numbers that should have been done to learn more about this disease.
It was one of the questions I put to Dr. Wargotts, and he managed to find one of the debunking theories that came out from the WHO, which says COVID-19, WHO prohibits autopsies, and that was false. And what they were saying was that essentially that they didn't have any issue with autopsies, but the guidance was that procedures must be performed in an adequately ventilated room. That means one with at least natural ventilation, or negative pressure rooms using mechanical ventilation. And I know I'd spoken to another pathologist who said that in most places, natural ventilation would mean that you could open all the windows, I guess. And negative pressure rooms are not that common. Is that about right?
Yes, that would be correct. In Africa, adequate ventilation does mean you just open the windows. But in other parts of the world, they had very good facilities. After the mad cow outbreak in Britain, a lot of the autopsies were upgraded to include laminar flow. They had laminar flow in them. The autopsy facilities, they had the most magnificent autopsy facilities. So there was no reason why autopsies could not be done there.
So, and this is where the issue comes, Shankara, with regards to one of the questions, because sometimes we get into these conspiracy theories, Shankara. And so the impression could have been on social media that this is being blocked by major organizations. And I'm trying to, if they were trying to protect the interest of pathologists, and they were saying, don't do it unless you have clear, adequate, safe, appropriate facilities, don't do it. Is that unreasonable, Shankara?
Look, I don't think it's unreasonable, Philip, but I think we've got to look at the pathogen itself. We had doctors in hospitals wearing hazmat suits and treating patients. And that is at the most infectious point in the evolution of a virus. So when you're looking at a patient that's demised, taking the same kind of protective measures are actually more than adequate to examine autopsy, to do autopsies. So I think there was fear around the potential for infection amongst pathologists, like the fear amongst doctors in treating patients out of hospital, and that had negative effect on the pandemic itself. So yes, here in South Africa, people were barred from funerals. We had caskets being wrapped in plastic cling wrap to prevent spread. limiting the numbers of people to those funerals. So I think the presiding fear was a great cause of the lack of autopsies, amongst pathologists being afraid to actually undertake autopsies.